الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Scabies. It is a work-related disease sometimes by Professor Mahmoud Hani Sulaiman. This slide shows the composition, the macroscopic composition of the skin. It contains epidermis, dermis, and hypodermis. The epidermis composed of stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. Stratum corneum, this is the part that contains Scrophis scabii parasite here. The other two layers, dermis, papillary region and reticular region, and below hypodermis, adipose tissue and areolar tissue. Etiology of scabies. Mite Sarcoptes scabii subspecies hominis. Adult female mite burrows in stratum corneum of skin and lays egg, which gives larvae emerge in 4 days. Gives nymphs, gives adults, which mate and lay eggs. Entire cycle takes about 17 days. Sarcoptes scabii subspecies canis acquired from dogs. This is important. This is one of the diseases a dog can transmit it to his owner. Can cause a self-limited mild infestation in humans, involves area in direct contact with infested dog, and will resolve without specific treatment, but will make some difficulties. Epidemiology. Source are humans transmission by prolonged close personal contact because of large number of mites in exfoliating scales. Even minimal contact with patient crusted scabies can lead to transmission. A patient with crusted scabies can contaminate clothing, bedding, and furniture. Scabies transmitted as long as patient infested and untreated, including even before symptoms develop. Epidemiology 2. Endemic in many countries worldwide in cycles, approximately 15 to 30 years, every 15 or 30 years. All socioeconomic levels affected without regard to age, sex, or standards of personal hygiene. Scabies in adults often is acquired sexually during performing sex. Incubation period in people without previous exposure is 4 to 6 weeks. People previously infested, sensitized, so develop symptoms 1 to 4 days after repeated exposure to mite. However, reinfestations are milder than original episode. Clinical manifestations. Scabies will lead to intense pruritic erythematous papular eruption. Pruritic erythematous papular eruption due to burrowing of adult female mites in upper layers of epidermis, creating serpiginous burrows. Itching is most intense at night. Clinical continued. In older children and adults, sites of predilection are interdigital folds, flexor aspects of wrists, extensor surfaces of elbows, anterior axillary folds, waistline, thighs, navel, genitalia, areola, abdomen, intergluteal cleft, and buttocks. This picture shows the places where the scabies might be found. Here on the right side, upper right side, here, 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 as you see, here, and here. Scabies causative organism, Sarcoptes scabii, hominis. Primary lesion, pleomorphic, mainly Barros. Diagnosis, scrap with 10% KOH, mites and eggs and fragments will be found. Treatment, all members of the family. First, treatment of secondary infection. This is important. Then, sulfur, permethrin, malathion, ivermectin, antihistaminics. The treatment will be given in details later. This is Norwegian scabies. Very many, much of the lesion. Here is scabies barus, as you see here in the middle. Here is scrotal, post-scabitic nodule, scrotal, where arrows. Clinical manifestations too. In children less than 2 years, eruption is vesicular and often occurs in areas usually spared in older children and adults. These areas are in children less than 2 years, scalp, face, neck, palms, and soles. Eruption is caused by hypersensitivity reaction to proteins of the parasite. Clinical manifestations. 3. Characteristics scabitic burrows appear as gray or white, tortuous, thread-like lines. Excoriations are common. Most burrows obliterated by scratching before patient seeks medical attention. Occasionally, 2 to 5 millimeter red-brown nodules are present, especially on covered parts of body, as genitalia, groin. Nodules due to granulomatous response to dead mite antigens and faces. Nodules can persist for weeks, even months after effective treatment. Cutaneous secondary bacterial infection may occur due to strep pyogenes or staph aureus. Even MRSA studies demonstrated a correlation between post-streptococcal glomerulonephritis and scabies. These figures shows the burrow here on the arm, and here is enlarged mite. This is the mite. Here, this is magnificent. This is very good. This is the mite and putting their eggs. These are the burrows. Here the arrows indicating the burrows. And here is the parasite sketch of the parasite laying eggs. Diagnostic test, clinical examination, confirmed by finding mite or mite eggs or scabiala, feces of the mite, by scrapings of papules or intact burrows, preferably from terminal portion where mite found. Mineral oil, microscope immersion oil, or water applied to skin facilitates collection of scrapings. A broad blade scalpel used to scrape the burrow. Scrapings and oil can be placed on a slide under a glass or cover slip and examined microscopically under low power. Adult female mites average 330 to 450 micron in length. Diagnostic test 2. Skin scrapings provide definitive evidence of infection, but with low sensitivity. Handheld dermoscopy used to identify in vivo pigmented mite parts or air bubbles corresponding to infesting mites in stratum corneum. Treatment detailed. Previously, I give summary. Treatment detailed. Topical permethrin 5% cream or use of oral ivermectin, both are effective agents for treatment of scabies. Experts recommend starting with topical 5% permethrin cream as drug of choice, especially for infants and young children, not approved for children younger than 2 months. pregnant or nursing women. Treatment 2. Permethrin cream should be removed by bathing after 8 to 14 hours. Children and adults with infestation should apply lotion or cream containing this scabicide over their entire body, below head, because scabies can affect face, scalp, and neck in infants and young children. Treatment of entire head, neck, and body in this age group is required. Special attention should be given to trimming fingernails and ensuring application of medication to these areas. Alternative drugs are 10% crotamidone cream or lotion, or unapproved 5 to 10% precipitated sulfur compounded into petrolatum. Treatment 3. Scabitic lesions are resulting from hypersensitivity reaction to mite. Itching may not be subside for several weeks despite successful treatment. Use of oral antihistamine and topical corticosteroids can help relieve this itching. Topical or systemic antimicrobial treatment for bacterial infections of excoriated lesions. This is the crusted Norwegian scabies. I show you the picture before. Is an uncommon clinical syndrome characterized by large number of mites and widespread crusted hyperkeratotic lesion. Large number of mites and widespread of crusted hyperkeratotic lesion. Crusted scabies occurs in people with debilitating condition, people with developmental disabilities, or immunocompromised. Crusted scabies also can occur in healthy children after long-term use of typical corticosteroid treatment. Post-scabitic pustulosis is a reactive phenomenon that may follow successful treatment of primary infestation with scabies. Affected infants and young children manifest episodic crops of sterile pruritic papules and pustules predominantly in acral distribution, but lesions may extend to a lesser degree onto torso. Now, control measures will begin. Isolation of hospitalized patient in addition to standard precautions. Contact precautions are recommended until patient treated with appropriate scabicide. Control measures continued. Prophylactic treatment recommended for household members. Prophylactic treatment recommended for household members, especially for those having prolonged direct skin-to-skin contact. Symptoms and signs of scabies infestation can appear late, as 2 months after exposure. During this time, patients can transmit scabies. All household members should have treatment at the same time to prevent reinfestation. All household members should have treatment at the same time to prevent reinfestation. Control measures continued. Bed and clothing worn next to skin during 3 days before initiation of treatment should be laundered in a washer with hot water and dried by hot cycle. Mites do not survive more than 3 days without skin contact. Clothing that cannot be laundered, removed from patient and stored for several days to 1 week to avoid reinfestation. Prevention. Children can return to school after treatment completed. Epidemics and localized outbreaks may require stringent and consistent measures to treat contacts. Caregivers. This is where it can be occupational or work-related. Caregivers who had prolonged skin-to-skin contact with patients may benefit from prophylactic treatment. Environmental disinfestation is unnecessary. Prevention 2. Thorough vacuuming of environmental surfaces is recommended after use of a room by a patient with crusted scabies. People with crusted scabies and their close contacts must be treated promptly to avoid outbreak. وأقول الحمد لله رب العالمين وشكرا جزيلا. Thank you for your good listening.